Welcome and good afternoon. I am Amy Ellsbury, Senior Director of External Affairs at the Urban Institute. I want to thank you all for joining us today for this briefing on the needs of families with young children. The panelists will be examining survey data researchers have collected from families and talking about ways policy staff can use the data themselves. I want to thank Urban Institute researchers Gina Adams and Erica Greenberg, and Phil Fisher of the University of Oregon for bringing Urban into this work. Thanks also to Phil for joining us as a speaker today, and thanks to the Heising-Simons Foundation for their support of this event. Before we begin, a few housekeeping notes. This event is being recorded. The recording and the links will be posted online after the event. All participants are muted. You can type your questions or comments into the questions box at any time. We will get to as many questions as we can, but even if we can't answer them, it's helpful for us to hear what you are thinking, so that can help us shape what we do in the future. And if you'd like to tweet about the event, please do use the hashtag #LiveAtUrban. At the Urban Institute, we strongly believe that facts, data, and evidence matter. Urban is a nonprofit research organization that does not take positions on legislation, but our independent experts make policy recommendations based on research and evidence. Their research helps frame and provide meaning to complex economic and social issues. Our researchers dig into nearly every policy, and this year they're particularly focused on racial equity and the effects of the COVID-19 pandemic. Through this partnership with the University of Oregon, Urban researchers had access to a wealth of timely data they could use to advance important policy conversations affecting young children and their families in the wake of the pandemic. The discussion today will focus on trends in families and children's well-being, the inequities the pandemic has surfaced, and what data can tell us about potential solutions. More than 40% of households surveyed said they're worried about paying for basic needs, and more than half of children from families facing financial hardship are feeling emotional distress. The effects of this distress and instability will be felt for a lifetime, unless there are evidence-based solutions to help the youngest Americans. Understanding the data is critical for policymaking. As our speakers will describe, the survey data can provide insight on which policies are serving families and which are not. The data also give us insight into which problems are most pressing and which solutions most urgent. We hope that this briefing will inform your work. Please don't hesitate to be in touch with us after the discussion if you'd like to dig in further, or if you'd like to learn about our data and insights on many other pressing challenges the country is facing. You can reach us at externalaffairs@urban.org, and we'll post that email in the chat. So now I'd like to introduce Erica Greenberg, a Senior Research Associate at Urban Institute, and Phil Fisher. He's the Philip H. Knight Chair and Professor of Psychology at the University of Oregon. And I'm going to turn the program over to Erica to lead. Thanks, Erica.
Thanks, Amy, and thanks to everyone for joining us today. Urban was thrilled to partner on this project to help bridge the gap between data and policy and think about the links between families' well-being and policy areas like housing, health, and education. But I wonder if we can step back a minute to talk about how the survey started and how it's evolved. Phil, can you share a little bit about the initial thinking that led to the rapid survey and talk about how it's changed since last spring?
Absolutely. Thanks, Erica. And thanks to everyone at the Urban Institute for organizing this and for inviting me to participate. We at our center at the University of Oregon realized very early on in the pandemic, last February and March, that the nation and really the planet was facing circumstances that, that nobody had experienced before. And because a lot of our work really focuses on well-being in early childhood, prenatal to age 5, we knew that policymakers and others, advocates for families, really needed high-quality scientific data about what families would be going through over the time as the pandemic unfolded. We knew we needed to collect nationally representative data that helped us understand the needs of families that included sort of representativeness based on race and ethnicity, income, and geographic distribution, where people are in the country. And we also were certain that the pace at which things were unfolding and changing required us to collect data on a regular basis. So we started in April and launched our first survey of over 1,000 households, and we continued to do weekly surveys through the end of July. And then we shifted to to every other week surveys after that. The every other week surveys are ongoing. There are families with children age 5 and under. And we have been able to collect data in English and Spanish. We collect via smartphone or tablet. We pay people about $5 for every time they complete the survey. And we, as a result of this, as you know, Erica, have kind of collected a wealth of information that Urban has really been doing a great job of disseminating and kind of getting onto people's radar.
That's great, Phil. Thanks for that overview. So one of the things that really struck us as valuable in this survey was that it allowed us to track changes over time and to see how families' experiences were changing in response to policy changes, relief efforts, and the virus itself. So for example, we noticed early on that parents of young children with disabilities were reporting much higher levels of stress and depression than others, but by late summer, parents' anxiety had stabilized. That led us to investigate how disability services under IDEA had adapted to the pandemic environment and what schools could learn from them about reopening. For instance, we saw that some disability providers found success by engaging whole families, not just children, online, and by relying on multiple funding streams for support. And both of these strategies we thought could also help K-12 schools. So are there other trends or changes over time that really jump out to you?
You know, Erica, the thing I think that the collecting across time has really shown us is the extent to which relief packages that have been provided are able to impact family well-being and also just sort of the widespread level of need. So when we started the survey in April, it was a time when a lot of the initial pandemic unemployment and the stimulus checks were really kind of taking effect. And so what we saw was that actually there was a drop in the number of families that were reporting serious financial concerns from about 40% during those early weeks of April to around 20%. What we saw is that when the CARES Act ended in August, the numbers went back up and they were actually headed in that direction sort of in early summer and continued to increase over that period of time during the summer. So that not only, as Amy noted, were families in August worried, 40% of families worried, but as we followed families through the subsequent months into the fall and winter, we see that about 40% of all households with young children in this country are reporting that they're having difficulty paying for basic needs. And so that ebb and flow, I think, where relief packages made a difference, but then when the relief became harder to access or went away, we see more families entering into this place of hardship has been a really major finding of our data.
That's so important and will be really useful as discussions about the current proposal for additional relief move forward.
Absolutely.
So the other element that we thought was really valuable in this effort was the nimbleness of the survey, nimble really being the watchword throughout this pandemic period. We've had many, many conversations about new areas to explore, particularly as case counts and relief efforts ebbed and flowed, and we got a better sense of just how profoundly the pandemic was affecting families. Concern about school and childcare reopening was just one issue that's changed remarkably in recent months, really forcing some very difficult decisions. I wonder if you can talk about some of the data that arose from questions that we added along the way.
Yeah, it's such a great question. And again, Urban's been an amazing partner in doing this. For example, when we started asking about the financial status of families, we were really only asking about, has your income taken a hit? And it was really through our partnership with you that we started getting much more into details about, do people have enough food on their table? So, or, is hunger an issue? Are they worried about being evicted? Do they have enough money for the rent? What's happened with their utility bills? And that's led to a level of granularity and detail that's been super critical. So like one unexpected finding is that the one basic need that has the highest rates of people expressing concerns about is paying for utilities. And our sense is that the reason for that is because people are buying food first and paying rent when they can second. And so utilities is kind of taking a back seat. But needless to say, in the middle of winter, being concerned about having your power turned off or your water turned off would be a huge problem for families with young children. Also, Erica, this is just a really quick additional example. Some of our partners who are more connected to policy and advocacy have asked us questions like, do you know what portion of households are redshirting their kids from kindergarten? Because we need to know like how many kids skipped kindergarten this year so that the education system can be prepared and who those kids are. So we added a question to the survey and asked that specific question and found out that 17% of all households in our survey had decided, with a kid who's about to start kindergarten last year, had decided to hold them back. And we also found that that was very disproportionately affluent families that were making that decision. So I think there are a lot of things like that where when there are questions of interest, we can add them into the survey and get information back to people quickly. And I would just sort of put that out as an offering, because we're moving forward to continue to do the survey, that if people listening in on this call have specific information that they would like to know about, reach out to us. And if we don't have the data, likely as not, we can add it to an upcoming survey and get data to you and get it into your hands so that you'll be able to use that information.
So valuable for policy and the field at large. Thank you for that offer. Across all of the work that we've done together, as you're mentioning, there have been some of these key themes that emerge. And I just wanted to present a few here for folks to think about and see about implications for their own work. So first, just that the most severe effects of COVID have been on the well-being of Black, Latinx, low-income families, and families with single parents and children with disabilities. There has been real disparate impact of COVID, not only in a health sense, but also on the social and economic well-being of families. Two, that supporting children means supporting families with a modern public safety net and safe options for childcare to get to that chain reaction of hardship that you were describing, Phil. And three, that the public health crisis has brought on economic and mental health crises that will last well after the virus is under control. So they really warrant policy attention and investment for years to come. Now, I don't want to lose sight of the fact that while Urban comes at this work from a policy standpoint, you come at this work from a child development standpoint. As a neuroscientist, what do you make of these data and what's at stake?
That's a really great question, Erica. I suspect a lot of people on this call have heard the term toxic stress. It's like one of those terms that gets thrown around a lot. I think, people now talk about it like, oh, I had a terrible experience at the restaurant with getting service and I was feeling toxic stress. But there's actually a very precise definition that scientists have developed about what toxic stress is. Toxic stress is something that happens to young children when they're in difficult circumstances, and the biological systems that we all have built in to help us deal with stress, things like mobilizing your immune system and helping to metabolize stored energy in your cells, which helps us deal with these kinds of stresses and bring the body back into balance. When those systems are activated quickly, they work really well. Body comes back into balance and they shut down. But when kids are exposed to kind of chronic conditions where those biological systems are activated all the time, that's more of a concern. And it's especially a concern, Erica, when parents who especially young children rely on to help buffer them from those kinds of experiences. Actually, when you're born, you don't have the capability to regulate those systems. And that's why we rely on relationships with sensitive, responsive caregivers to help regulate these biological systems. So what we're seeing that's been so troubling as neuroscientists is that these conditions, especially when families are just having a hard time attending to things like whether there's going to be enough food on the table or whether they're going to be out on the street, are stressing out parents, and that's being passed along to kids across time. So we're anticipating that kids are, in many instances, having these biological systems activated, and that their parents are preoccupied with things that's making it harder to be attentive and nurturing and responsive. And that is what we would define as toxic stress. And we know that when toxic stress occurs over protracted periods, that we can see long-term effects on the biology of the brain, that is actual changes to the integrity of neural circuitry and things like that, and the density of neurons. We also can see long-term effects on things like learning and academic achievement and social emotional development. And there is an increasing amount of evidence, again, probably not a surprise to anybody, that these things are also linked to long-term health concerns. So the greater likelihood of obesity and diabetes, of metabolic disorders, of heart disease, of inflammatory illnesses like asthma. And I don't mean to paint too bleak a picture, because this doesn't mean it's deterministic. Everybody who's stressed is going to, have lifelong difficulties. But I think we're deeply concerned about the large proportion of families with young children that have been exposed to these exact conditions during the pandemic.
Absolutely. It is critical for the health and well-being of our next generation. It's something for policy to attend to in the short and long term. Now, I know there are folks on the call who are going to be concerned about these issues and want to know what the data say about their state, or maybe even want to access the data themselves. And we encourage everyone to start entering questions into the Q&A if you've got them, or to enter them in the next few minutes. And we'll turn to Q&A towards the end of the session. But first, can you talk a bit about the questions that the survey can help answer and how people can make the best use of the data going forward?
Yeah, great question, Erica. So first of all, when we started the survey, one of the things that we thought would be most important was to get quantitative data, so that you could, for those of you on this call, could say like, okay, 40% of all households with young children are saying that they can't pay for basic needs. That's important for thinking about passing relief packages. But those quantitative data, we felt like only told part of the story. And what we realized along the way was we started asking open-ended questions as well. So what things are going well for you right now? And what kinds of things are you taking comfort in? What are the biggest challenges that you have? And later on, actually, we started asking this one question about, what do you wish your policymakers and elected officials knew about what you're going through during the pandemic? We have over 100,000 open-ended responses, many of which are brief, but some of which are a lot longer, that tell the story in a very different way than just, statistics and percentages, that are in many ways just a kind of a diary of what families in this country have been going through. And that information is in a searchable repository that people can use to get information about families in their own state, that families can use to, or that people can use to get information on specific topics, because it's searchable. So if you want to know about special needs, if you want to know about vaccinations, if you want to know about hunger or food, you can just put in those search terms, and you'll get from these 100,000 plus responses a list of quotes that can be really useful. I think that's a huge resource. In addition, there are blog postings that Urban's been putting out and that we've been putting out as well. We also have developed an item bank so that people can look at each of the questions that we've been asking, and that can potentially be used for people to create their own surveys. So lots of different things that people could access. And as I said, we're also just really eager for people to reach out to us and ask if there's information that maybe they can't easily find, but that we might either have or could add to subsequent surveys.
That's great. And in partnering on this work, we've been looking at a number of other data sources that can supplement the rapid survey and provide context. So the Census Pulse survey, of course, has been terrific at documenting COVID's social and economic impact across the country. The Urban Institute is fielding versions of its health reform monitoring survey and well-being and basic needs survey, which were quickly revamped for COVID response. And there have been dozens of surveys done by researchers, state and local agencies, and journalists that can really speak to federal policy. So all of those are great for putting the rapid data in context and generating insights for policy. So I think we're going to move to Q&A in just a moment. Phil, do you want to say anything about the survey upcoming for 2021?
Just that we have several things in the works. We've been doing this national household survey, and that will continue. We'll continue to launch that every other week. In addition, we're going to launch in parallel a provider survey so that we can learn more about the experience of childcare providers. We know that the need to build up and build back a stronger system of childcare, especially for informal, but also for regulated and licensed childcare, is going to be really critical to economic recovery and to families with young children being able to participate more effectively in the workforce and the economy as things move forward. We are also in the process of developing capacity for doing state and local surveys, because we see this as a tool that can really help to inform policy decisions at levels where policy is made. And just having national data is great for nationally representative samples and for the federal government and federal policymakers, but we know that a lot of policies made at the state level, and therefore having representative data in your state or in your city is going to be equally important. And then we really hope to be able to continue our partnership with Urban, because Urban has been so effective at really helping to contextualize and make use of the data and get it into the right hands.
That's great. So we have questions coming in from the chat. Thanks everybody for submitting them. And the first one is about inequities. We know that's a priority for the new administration and something that we've talked about a little bit in this conversation already. But folks are curious, who seems to be doing better over time and who's doing worse, and how can policy help?
You know, I think it's the case that that to the extent that people have been in contexts where they're able to access their support networks, even if those support networks have changed considerably, that's made a huge difference. I also think that we see consistently that people who are have been able to access childcare, or they haven't lost childcare, or they don't have the means to get back to childcare, are ones who are doing better. So I think those are like two qualities. The other thing I would say is that, you know, there in the sort of difficult stories about the huge number of families that have entered into difficulty paying for basic needs, one of the trends that we've seen is that after the CARES Act ended, we ended up with double the number, 40%, saying they were having a hard time. But those numbers didn't continue to increase. They stabilized across time. And so it definitely appears that there's a portion, a sizable portion of families with young children who have managed to kind of take shelter from the storm, who have enough economic security, who've been able to work from home, and who have the kind of support networks to take care of their children, that they're doing okay. I think the question is, like, for those for whom they haven't been able to take shelter, and more who ended up after CARES ended, really in the center of the storm, how we can now get the protections back in place by providing the kind of relief that's going to be most necessary.
That's helpful. And just to add, some of the findings are around hardship facing single parent families and families with children with disabilities. And so those are in some ways of targeting relief to families that we haven't seen in federal policy in quite some time. So that's something else that the survey has revealed, just this need to target the families with greatest need who are being defined in new ways because of the new situation we're in during the pandemic. We've got a question here. How's the survey been able to gather information from families without easy access to the internet or otherwise in unstable environments?
So the survey is administered online, but you can do it with a smartphone or a tablet that has cell service, because it's just a you know, sort of like push the button or type in text to the open-ended responses. It's possible to do that. You don't need Wi-Fi, you don't need broadband, there's no like video conferencing or anything like that. I can say that in spite of that, of course, families that are without any kind of connection to the internet at all would be would have difficulty accessing. In addition, although we've been able to do the survey in English and Spanish, for people whose primary language is something other than English or Spanish, they have not been able to participate in the survey.
It's good to know. Here's another question. The audience member would like to know more about the impact on single parents in school themselves with school-age children.
So I would love to get back to you, Ashley, who asked that question about this. And so I'd love to have you follow up so that we can give you more information. I can tell you, and Erica's alluded to this, that single parents are one of the groups that consistently, like in every time we look at the data in every respect, whether it's access to healthcare, access to childcare, financial hardship, single parents definitely are one group that has really had a lot more challenges during the pandemic. The specific question about student parents, so parents who are themselves are in school, is a really interesting question. And we do have the ability to analyze the data at that level, and we haven't done so yet. So I think the specific needs, if you're in school yourself and raising kids, is a great question and something that we can follow up on and get that data to you. So stay tuned. But definitely in terms of single parenthood, it's one of the big risk factors, just like, as Erica mentioned, having a child with special needs seems to consistently fall out as something that's really difficult.
Great. So there's been lots of speculation about a pandemic baby boom or a baby bust. Have you asked about how families are thinking about having more kids in this time?
We haven't asked about that in the survey yet. I think it's a great question, and we will definitely consider adding it into the future surveys. But I will say that this is actually a really important issue from a global perspective. I think the idea that there have been more babies conceived during this time in this country is sort of like oftentimes an issue where people sort of think, oh, that's an interesting potential effect of people being stuck inside a lot. But in countries where women have harder access to birth control, it's actually a major public health concern and a gender equity concern that there may be more young girls who are getting pregnant during this time and will therefore leave the education system, and basically that the gender equity issues that are a huge issue globally could come into play. And I would expect that may play out in similar ways in this country as well. And so it's something that we should be on the lookout for.
Very helpful. What are the biggest stresses on families with members experiencing disabilities?
Isolation and loneliness is clearly something that preceded the pandemic. It was something that we know from our own research and lots of others that is a challenge, that is having people who are understanding what you're going through and who can help when it can be difficult to have those kinds of social connections. But the other thing that's very clear is that access to services has been a huge challenge for families with a child with disabilities. So the majority of early childhood special ed services are delivered in person, either in home or in childcare settings. The pandemic virtually eliminated the ability for those services to be delivered in that way. And as much as so many of us have just shifted to Zoom and video conferencing, it turns out that that's really, in many instances, a very inadequate platform for providing services for kids with special needs in their household. So the ability to interact with somebody on a screen, to stay focused on something that's just a two-dimensional space, all of those things, we find that not only are parents saying this, but people who provide these services are saying that it's just become incredibly challenging to deliver the kinds of services needed to help promote subsequent development and developmental progress in this population. And so I think, in addition to overall learning loss and concerns about how this situation is going to affect the general population, I think we have to be especially concerned about what we'll be seeing in kids with special needs as things reopen, in terms of the lack of access to services for early intervention, which makes such a big difference in terms of addressing those needs. Great question.
Absolutely. And for this population, we see the need for a child vaccine even more pressing than for others, given that children with some disabilities often have health disabilities as well.
So
for schools to truly reopen, that's really got to be a priority for investment and dissemination.
So true.
So I see we're coming to the end here. Amy, I'll pass back to you. Thanks everyone for your questions.
Thanks so much, Phil and Erica, for this deep dive into the data about what's happening for kids and families during the pandemic. For me, it really reinforces the important back and forth that needs to happen between policymakers and researchers. And we so appreciate all of you who joined us today and being here for the discussion. Thank you, everyone, and take care.
Thank you.
Thank you.